Hi everyone, so today we are going to do a transgender male to female feminization procedure. So this feminization procedure will involve a 360 degrees liposuction, a fat transfer to the buttocks. We will create a deeper waistline for her, and there is a little bit of already existing chest tissue. So we are going to start with doing the abdomen liposuction, 360 degrees, moving on to the flanks and the waistline. We are going to create a curvaceous look in order to do the male to female transformation. She also has a little bit of armpit fat that she wants removed, so we are going to remove that fat, and we are going to retain most of the chest or the breast tissue, and the main idea would be to finish the liposuction and finally create a wider hip in order to give a curvy look. So we'll be doing the armpit liposuction here. We're going to be retaining most of the fat in the chest tissue. These are the markings which have been made. This is where the narrow waistline is going to come, and this is the flank region. Usually in men are usually have a straight side profile or a V profile, whereas in women we have a deeper waistline and a curved profile. So for this male to female feminization procedure, we're going to create that deep waistline, remove all of this love handle fat, and then we're going to add the fat onto the hip region. So liposuction involves usually 3 steps, and the first step is irrigation of a local anesthetic fluid, which we infiltrate or through this fine cannula. So this has the fluid running through it, and we are aiming in liposuction, aiming at the subcutaneous fat or the fat underneath the skin. So what we do in this first step is let the local anesthetic fluid get into the fat spaces. So it will help us for an easy fat removal later. So this is the step 1 of liposuction. We are doing the step 2 of the liposuction, where we are going to try to liquefy the fat, and this will happen through the Vaser device, which is a vibration assisted high frequency ultrasound device. And this probe here will emit your high frequency ultrasound waves along with the heat energy, and that is what is dissolving and emulsifying the fat, which will become easier later for us to take off with the suction device. So this is the Vaser probe, and this is what we will use. So the Vaser means the vibration amplification of sound energy at resonance. So this particular probe will have high frequency ultrasound waves, which also will have a tip vibrating, and the sound energy is getting emitted, and these sound energies and the high frequency ultrasound will help to dissolve the fat, liquefy the fat, which makes the liposuction much easier. It helps to dissolve the fat much easier, the bleeding is less, the tissue damage is much less as compared to a manual liposuction. So I'm doing a little bit of fat removal through a manual liposuction probe. This is a fat harvesting cannula. It has got multiple holes and it's only about 2.5 mm. So I'm going to take out a little bit of fat from the armpit area and the side of the chest wall, and this would be a really good fat also to use for the buttock fat grafting. So as you can see, since it's a long procedure, we are having 2 people work on the patient, and this is us taking out the fat from the sides of the chest wall. And this is a really good structure where we use to collect the fat, and once the fat is collected, we agitate this canister a little bit, allow the fat to settle. Then the fat component will separate from the fluid component, and the pure fat is then injected into the areas of fat transfer. So today we are finishing the liposuction in the abdomen 360 degrees, and we are going to inject all of this fat into the buttock area to provide the butt augmentation. We plan to inject around 600 to 700 ml of fat in the hip and buttock region in this patient today. So here we can see the fat which has been harvested from the abdomen region, and we have allowed the fat to hold for some time. And once the fat settles, you can see the clear separation between the fluid component and the pure fat component, and it is this pure processed fat which we will inject into the areas of augmentation or enhancement. So in the abdomen, the fat that we target for the liposuction is the subcutaneous fat, the fat only beneath the skin. The fat which is around your internal organs, also called as the visceral fat, is not targeted with liposuction. That is the fat which you can only reduce with diet and exercise. So in liposuction, our procedures are only above the muscle. We never go deep to the muscle and we never go to the internal organs. So it is a rather superficial procedure done with 2 to 3 millimeter cuts. That's why we call it a keyhole procedure. So we are going to start injecting the fat. We will, since he is in a supine or lying down position, we will start by injecting the fat in the side hip region. That is where she wants the fat to be augmented and the hip and fat to be augmented. So we will use a very fine cannula, and this is only about 2.5 millimeters, and the fat is very gently injected through these tiny syringes, starting with the hip region. So you can see the vaser, and that is the ultrasound wave being emitted. The noise you are hearing is the ultrasound heat waves, which is going to emulsify the fat, and no force is applied while using the vaser, and hence the fat is broken down much easier than the traditional manual liposuction, and that is the advantage of vaser as compared to the traditional liposuction. Also, the heat is what makes the skin to pull back and give the final shape. So now we are halfway through the procedure, and we have finished the liposuction of the front of the abdomen and also of the armpit area and the sides of the chest wall. We have already transferred about 250 cc of fat in the front of the hip region. So you are already seeing that the shape is coming into play, and the waistline is now narrowing and the hips are looking a little widened, but we still have the main waistline and this particular love handle fat which has to go, and we will do that in the next position, and then you're going to see the final results once this love handle fat goes and we go deeper on the waistline. We further will be adding a little bit more of fat in the buttock region, but after we change the position. So we are here and we are doing a transgender procedure and making the body a little more feminine. So in this process, we have already completed the front of the abdomen. As you know, most of the men have a V-shaped torso or a straight torso. However, in a woman, we need to create a curve. So since we are making this a feminine body, we are going to go more deeper on the waistline. The most important area is this, and that is the just above the hip bone, and this is the love handle area or the flank area. And once we remove this fat, you will notice that the body will look a little more curvaceous. We have already filled amount of fat into the front of the hip, and we are going to further add a little bit more of fat on the upper buttock and the side of the buttock area, and you will see the results soon. So now you can see we have completed the flanks, the waistline, and you can see how a curve has formed. We have put about 500 cc of fat in the buttocks as well as the hips, and we have taken off all the fat in this love handle area, and now you can see how a straight body can be converted into a curvaceous body, and that is what is creating a feminine appearance. So we have just completed the male to female transformation. We have finished the armpits, we have done the waistline, and now if you see, you can see a curvy looking body. Fat grafting has been done to the hips and buttocks, and there is a complete body transformation, and from a more straight look, we have completed a more curve looking figure.